You talked about the nursing shortage right here earlier in the pandemic. What's that shortage like now?
So the big difference that's happened in the last 12 months is that this is a workforce that is overworked, burnt out, and experiencing excessive stress. Our most recent third annual report on nurses in the U.S. showed that one-third of nurses are considering leaving the profession permanently by the end of the year.
So how has the pandemic changed, potentially this industry for the longer term? I mean, are we expecting the impact of the pandemic to impact the availability of nurses for years to come?
Absolutely. I mean, even before the pandemic, our demand for healthcare as a country was increasing because our population is aging. But pandemics are certainly demand shocks on the system that put more constraints on more strain on the healthcare system and the need for even more healthcare workers to fill that demand.
The CDC just announced a huge overhaul of the agency, acknowledging mistakes they made during the pandemic, acknowledging a need to be more nimble and respond more quickly. What do you think went wrong there?
I mean, there were certainly some challenges with how the CDC collaborated and the way they communicated with the public, which they have some responsibility in terms of how intense and challenging COVID became in the U.S. And that, in effect, had affected the healthcare workforce as well. They were massively overworked, and hopefully with these changes, when and if there is a future pandemic, it won't affect or decimate the healthcare workforce as much as this last pandemic did.
What are the implications for the doctor and hospital marketplace? What are you seeing on your platform?
What we're seeing is, we now work with over 600 hospitals and health systems across 25 states, including very large ones like Kaiser Permanente and HCA Healthcare, and academic medical centers as well, like Johns Hopkins and Cedars-Sinai and others. And, every single one of these hospital executives that we're working with is dealing with this problem. They are tackling, shortages and understaffing on all their nursing units. There's even 30% of the employers on our platform are now using us for new graduate nurses, which was not the case before the pandemic. So this challenge is continuing to increase, and labor expenses and labor costs is negatively impacting hospital financials as well.
How do you hope Incredible Health will help bridge some of these gaps?
So, our focus is on ensuring that nurses are able to get the best permanent roles, but we also invest heavily in features and tools for nurses that are completely free. We offer free continuing education for nurses, free salary estimators. We even have an advice platform for nurses built into our apps. And we want to continue investing in that, including skill growth, educational scholarships, relocation support, in order to make sure that Incredible Health is a place where nurses can manage their careers instead of only the place where they find their permanent job.
Meantime, the U.S. is dealing with another, some would call it a crisis, the Roe versus Wade decision from the Supreme Court. Is this at all impacting your platform and the workers on your platform, especially those working in states where abortion is restricted?
Yeah, so it's not affecting the Incredible Health platform, but it does affect the nursing workforce in a couple of different ways. First, there's going to be an increase in volume of patients because when you restrict, that care, you're going to have more ectopic and more life-threatening pregnancies. So that increases the workload on the healthcare workers. Secondly, they have to consider the legal ramifications when they are supporting and counseling patients. And so they have to be very aware of their code of ethics as well as the legal regulations that they have to follow in their state and in their hospital. And then finally, it'll continue. The vaccine mandates were extremely controversial, and so is Roe v. Wade, even among healthcare workers. So that you'll have healthcare workers that are going to be on both sides of this discussion, which creates more, angst and debate and discussion and intensity in the workplace.
So how are you expecting this to play out over the next several years where, this could potentially happen in more states? You're talking about a bottleneck potentially already. Where are we 3 years from now?
I mean, every report we read, every projection shows that the shortage of workers is projected to continue unless we can do more to support this workforce and grow this workforce. the one positive that came out of the pandemic and you know, the CDC changes, even Roe v. Wade, is it put more emphasis on the importance of the healthcare workforce and how we need it to deliver care.